So we have been working on a process that has the ability to eliminate cells that cause graft-versus-host disease. So what we do is we take donor cells and we show them recipient cell, patient cells. The cells that recognize the patient become activated. And then when we expose these cells to a dye, the dye accumulates into the cells that recognize the patient. And interestingly, the cells that are exposed to this dibromorhodamine dye are exposed to visible light, then these cells are eliminated. So it's extremely interesting because we are able to eliminate cells that cause graft-versus-host disease, but theoretically preserve cells that cause graft-versus-leukemia and antiviral reactivity. Now we have some data to demonstrate that we are preserving we do have data to demonstrate that we are preserving cells with that have activity when are administered to the patient. But we lack a little bit of information on the nature of the cells that would fight the leukemia and fight the infections. And so that's why we are here to present data on the ability of these donor cells that are treated in this fashion to demonstrate antiviral reactivity and anti-leukemia activity by testing their functional activity against peptides found on these different agents, the viruses, and on the leukemia cells. We have performed phase 2 clinical trials of haploidentical stem cell transplantation, and we're able to demonstrate that we're able to do such haplotransplant without the use of any immune suppressor by adding cells that are able to fight infections and fight leukemia. And therefore we have very low relapse rates and low rates of infection. And really that prompted a lot of questions onto why we are observing such activity, and is there a scientific, solid scientific justification for doing this, in addition to all the tests that we have done that demonstrate that we're able to eliminate graft-versus-host disease from the T-cell product.